This presentation summarizes the data collected in the two-part community assessment for the southeast and Midtown region of St. Petersburg, Florida. The presentation will provide a brief historical overview from the earliest days of settlement to the current time frame, followed by the community analysis that will examine structure, population characteristics, health resources, environment, government and public policy, prioritize community problems, and the global community issue. In 1875, John Williams of Detroit purchased 25,000 acres of land on the peninsula, now known as Pinellas County. In 1888, Peter Demens, an exiled Russian nobleman, purchased a tract of land from Williams. He intended to build the first railroad connecting the area to Georgia via the established terminal in Sanford, Florida. As part of the bargain, Williams let Demens establish the name for the town, so he named it after his home in Russia. In 1890, General Williams built the Detroit Hotel, where it stands today. In 1914, Mayor Al Lang convinced the St. Louis Browns and the Philadelphia Phillies to make St. Petersburg their spring training home, creating the Grapefruit League. The early real estate boom saw the population grow from 300 in 1920 to over 50,000 people by 1925. The city soon developed a reputation as a tourist hotspot. The completion of the Gandy Bridge in 1924 reduced travel time from Tampa by half. In the early 1930s, growth had slowed under the influence of the Great Depression, but in 1939 the city received a cash infusion from Roosevelt's New Deal that funded upgrades to infrastructure and utilities. The War Department, in cooperation with the Coast Guard station at Bayboro, established technical training centers for U.S. Army airmen, bringing more than 100,000 troops into the area, filling every hotel and creating a housing shortage. This led to the need for and the development of low-cost housing in the southeast area. In the early 1950s, air conditioning was invented and popularized, making the area an attractive retirement destination. Many people were drawn to the mild weather. By 1955, the population had grown to over 200,000 people. Today, St. Petersburg is the fourth largest city in Florida and the 53rd largest city in the United States. Over 9.4 million tourists visit the St. Pete Clearwater area every year. Pinellas County is the most densely populated county in Florida, with 3,347 people per square mile. The statewide statistic is 350 per square mile. St. Petersburg anchors the Florida high-tech corridor, as illustrated on the map, and is ranked in the top 6 high-tech employment centers nationally. 60 Fortune 500 companies have made this area home for their corporate headquarters. Between St. Anthony's, All Children's, Bayfront Medical Center, and the numerous private practices, the healthcare industry employs more people in St. Petersburg than any other industry. There are 25 public schools in the survey area serving the K-12 population. They are under the jurisdiction of the Pinellas County School Board. SPC, USF, and PTech also have campuses in the survey area. Eckerd College is a highly accredited private liberal arts and business school that is located at the southern tip of the area. The 5 public libraries in the area offer educational and learning opportunities for people of all ages and backgrounds. Many services are available, including special services for disabled and shut-in cardholders, and getting a library card is free. The museums in the area include the Dolly Museum, the Museum of Fine Art, the Museum of History, the Holocaust Museum, and the Dr. Carter G. Woods African American Museum. This museum features a historic perspective from the segment of the community in regards to local, regional, and national history. This museum is in the heart of the survey area and is iconic of the Renaissance beginning to take place in the Midtown district. The performing arts venues include theater stage productions, opera, symphony, and a variety of other live music performances and entertainment events. There are 207 miles of roads under the city's jurisdiction and maintenance. This does not include the interstate system that divides the city in half. Many of the older residents of the survey area blame the construction for the interstate for current urban blight in their community. They say that the highway redirected significant amounts of traffic out of the business districts in their once thriving neighborhoods. Most of the major roads have bike lanes, but many of the roads in the survey area don't. The Pinellas Suncoast Transit Authority provides bus service throughout Pinellas County. All buses and bus stops are ADA compliant, and the PSTA offers fee-based, on-demand transportation for people that are unable to board a standard bus or get to a regular bus stop. More than 20 bus routes run through the survey area. 17 terminate, originate, or stop at Williams Park, which is known to be a popular place for the indigent and homeless population to congregate. The following slides presenting population data represent demographic characteristics that are influenced by the structure and environment of the community. Conversely, the population characteristics simultaneously exert their influence on the community structure and environment. This table represents comparative general population and housing statistics. It indicates that both the survey area and Pinellas County as a whole have lost a significant number of residents over the last 10 years. This is a possible indication that the survey area is not a place where people want to vacation or settle into a seasonal second home. Also note that the survey area is more densely populated than the rest of the county. This may be an indication of overcrowding out of necessity, and it does not take into account the individuals that are homeless and not included in the census survey. These tables indicate that the survey area has a higher percentage of unemployment and poverty than the rest of the county or the state. This factor is known to correlate with increased incidence of violent crime, decreased access to health care, increased rates of childhood morbidity and mortality, and increased levels of major health disparities. This table illustrates the income disparities within the survey area. In the community assessment, it was noted that there are some very affluent neighborhoods in direct proximity to the economically challenged areas. This fact tends to skew the numbers with some of the highest unemployment rates found in the areas with the highest mean and median incomes. In fact, look at the disparity between the median incomes within each zip code. The areas with the most household income over $100,000 have the greatest variation between mean and median income. This further illustrates the fact that most depressed neighborhoods in the survey area are surrounded by or intermingled with some very affluent neighbors. This chart represents a condensed version of the household income by zip code and ethnicity. It indicates that there are more rented and vacant houses than owner-occupied ones. Note, an increased percentage of African Americans correlates with an increased percentage of homes below poverty. This statistic is disturbing and alarming. The city stresses the importance of diversity in the community and the workforce, yet this segment of the population has become isolated within the survey area, and the vicious cycle of poverty, crime, poor health, and lower educational attainment continues, yielding all the negative effects associated with poverty. This map illustrates the data in the previous charts. Pink areas signify 25% or more of the population living below poverty levels. These are the same areas with the highest levels of unemployment, greatest incidence of violent crime, and the highest concentrations of African American residents. The population is affected by the structure and environment, as these community characteristics are influenced by the demographic composition of the population. Public service and safety are top priorities for the city, as demonstrated by the amount of money they spend to keep these vital services fully staffed and operational. Both the police department and the fire and rescue teams provide public education through the school system and special events. Every school has a school resource officer provided by the police department. There are 533 sworn officers and 735 total employees in the department. In 2014, the crime index in the Midtown area was down 4.2% over the past 5 years. This is a positive sign indicating that efforts to improve conditions in this area are actually starting to succeed. St. Anthony's, Bayfront, and All Children's are the three major hospitals in the survey area. Edward White was closed in November. St. Anthony's and Bayfront both provide acute, emergent, and critical care. Bayfront is the home of Bay Flight Rescue, and it houses a Level 2 trauma center. Both hospitals have outpatient centers and diagnostic clinics on their campus that accept low-income and underinsured individuals and families in the area. All Children's Hospital is a Johns Hopkins facility providing care for infants, children, teens, and families with challenging medical conditions. The Ronald McDonald House provides housing for families of patients that must travel long distances and remain with their children during extended periods of treatment. There are a variety of other health care agencies and organizations that cater to the poor and underserved populations. They are funded by various levels of government, private sources, charitable organizations, or a combination of all of them. This chart does not reflect it. However, there is a large population in Pinellas County, and particularly in the survey area, that is underserved. They have limited access to health care providers and services. The map on the following slide illustrates the point. Poverty and homelessness present the largest, most prominent barrier to health care and wellness. This is a universal concern affecting not only the survey area, it affects communities across the nation and around the world. Insurance companies, pharmaceutical companies, medical groups, and conglomerates tend to focus more on their bottom lines than the patient needs or outcomes. One must ask, how can we put a price tag on health and wellness? They're priceless. How much is human life worth? The County Health Department conducted a community assessment in 2014. This table illustrates the community's perception of the most important factors influencing community health and the most significant problems that lead to health disparity. Access to health care was ranked as the highest priority for a healthy community. Addiction was considered to be the biggest barrier to wellness, and it can be attributed as a contributing factor to many of the disparities listed below it. The 10 leading causes of death in Pinellas County are posted here. Cancer and heart disease take care of about 45% of it. Many of these illnesses can be preventable through healthy lifestyle adaptation and self-care practices. Healthy People 2020 suggests that primary prevention should include diet, nutrition, and exercise, avoid alcohol, avoid tobacco, and get regular checkups. Many of the poor and homeless are affected by these conditions on the left. Now add alcoholism, addiction, and mental health issues, and it's easy to see why this population is vulnerable. The city and county are proud to possess some of the cleanest air and water of any U.S. metropolitan area. The U.S. EPA has recognized Pinellas County and St. Petersburg as exemplary for their use, conservation, and management of water resources. Contamination risks are low and limited to surface storage facilities, leaching into well water, or a breach of the closed system integrity. Quality is assured by the Florida Department of Environmental Protection. The City of St. Pete Department of Sanitation provides pickup for solid waste and recycling twice a week. The Department of Sanitation is responsible for removing dead animals, furniture, and old appliances. They perform external rodent control treatment, and they maintain the refuse containers. Pinellas County operates the refuse-to-energy plant and the landfill operations. They go to great lengths to ensure that the environment is protected here. The majority of combustible refuse is burned to produce electricity to power the facility, along with 43,000 homes and businesses daily. 85% of the intake is burned or recycled. The incinerator has scrubbers so that only water vapor is released into the atmosphere. The remainder of the solid waste is buried with ash. The landfill is lined with thick layers of clay to prevent toxic waste from leaching into nearby groundwater or runoff to the nearby waters of Tampa Bay. They also recycle their cooling water with an on-site water purification plant. The list on the left presents 7 major community concerns revealed in a study done for Pinellas County. The list on the right is organized in order of priority based on causality. By attaining a higher level of education, an individual has a better chance of securing steady work or even professional career, thus lowering unemployment. With a good job, one can acquire better housing and afford improved means of transportation. With a good job and reliable transportation, access to nutritious food is improved, thus lowering the motivation to commit crime in order to survive. With a good job that is likely to provide insurance benefits, reliable transportation, and healthy eating patterns, healthcare services will become more accessible and at the same time will not be necessary to seek as often. When people are taking care of themselves through proper nutrition and healthy lifestyles that they learn about through higher education, they are less likely to need healthcare services other than maintenance. They will also be less likely to be victims of violent crime since the crime rate has decreased thanks to all of the things a proper education has provided this group of individuals. That is the rationale behind the priorities on the right. What are the local governments doing about the community concerns? The city and county are providing the maximum level of free and subsidized healthcare services that their combined budgets will allow. In order to increase services, they will need to increase funding. They have created an interlocal agreement and a pledge to the community to revitalize and clean up the urban blight in the heart of the survey area. The city has programs in place that will transition the homeless to independence rather than warehousing them or shipping them out of town to get them off the streets. The city and county are working with the community outreach programs to assist the provision of food, shelter, clothing, physical and mental health services, but resources are limited. Additional measures should be taken to increase funding to support occupational and vocational training, preventative measures, and rehabilitative services. The city council meetings are open to the public. The problem is that the population of interest in the survey area is composed of people that are least likely to attend. Most of them are not taxpayers, so they need qualified spokespeople. Dr. Marbett's current study in progress employs a very practical, sensible, and proven approach to reduce poverty and transition the homeless populations in a variety of communities. He suggests that they continue the culture of transition rather than warehousing and relocation. Reintegration into society is a fiscal and moral imperative. Officials, counselors, and the homeless themselves must realize this to end these cycles. Co-locate and integrate services as much as possible. Dr. Marbett noted in the initial inventory that the 50 community outreach programs that provide food, shelter, clothes, counseling, and health care in the area were not cohesive and had a tendency to enable the homeless behavior patterns rather than transition them. The integrated approach is more cost-effective and increases the number of service hits and their effectiveness. Implementing a master case management system will tie the government, nonprofit, and faith-based services all together. One case manager can develop and provide customized levels of service designed to be most effective with each family or individual's needs, thus further reducing costs and eliminating duplicity. Reward positive behavior with increased responsibility privileges such as better sleeping arrangements, increased educational opportunities, and increased privacy. Provide consequences for negative behaviors. More often than not, negative behavior goes unpunished. This enables the continuation of old behavior patterns. For transition to work effectively, consequences must be swift. These are tools that use an approach that mirrors the real-world situation. Redirect and discontinue external activities, like street feeding. Street feeding without comprehensive services attached enables the homeless to continue their patterns and is a barrier to transition and reintegration efforts. The well-meaning charities could co-locate with the providers of comprehensive services to avoid enablement. Panhandling must be eliminated. This is another enabling behavior that arms the homeless individuals with money that can be freely spent on alcohol, drugs, or tobacco. Oftentimes, panhandlers are not homeless individuals, but rather con artists that prey on generous citizens. In any case, it should be eliminated. Dr. Marbut has worked on homeless issues for over 30 years. After visiting 237 homeless shelters in Washington, D.C., he developed the 7 guiding principles of homeless transformation. Since then, he has visited 627 operations in 21 states. He holds a multitude of degrees in economics, international relations, political science, psychology, and American political process.